If you are a dialysis patient or anyone of your family, do not avoid those things carry some virus, very much important. Good morning. Welcome back. If you are a dialysis patient or anyone of your family is getting dialysis, do not forget to watch this video, because here I'll discuss a lot of information with what a dialysis patient must follow get badly affected by the COVID pandemic. So most important part is the basic hygiene. The most important is the hand washing with the soap and water. And if soap and water is not available, please sanitize your hand with 70% alcohol-based solution. Now there are few basic tips need to be followed up someone who is going for the dialysis. While we are going for a dialysis, do not wear a wristwatch, belt, do not carry any purse or any belongings which cannot be washed in the soap water. A lot of time it has been seen that patients who are going for the dialysis, they carry some book, they carry some tablets to read or to pass time during the dialysis session. It is better to avoid those things in this COVID pandemic era, because you cannot wash a tablet, you cannot wash a book which may carry some viruses while coming back from dialysis center to your home. While going to the dialysis, please try to keep a separate dress and which need to be washed while you are coming back. Similarly with your shoes, the shoes with which you are going to the dialysis center, do not wear it at your home, and returning back, try to wash them with a soap water. While in the dialysis centers, it is always advisable to wear a N95 mask during the entire process of dialysis. This is very much important because N95 masks are known to protect you from the aerosols, and during the dialysis session, do not put the mask off from your face. Keep the mask always on in the entire session of your dialysis. While going to the dialysis, it is better to avoid public transport if possible. If it is not possible, you can hire some auto or some cabs and go there separately, because where a lot of people are traveling together, you have a chance for getting infection of the corona from an asymptomatic carrier. Now it is mandatory not to eat anything during the dialysis session. A lot of patients who complain of hypoglycemia during dialysis, it is advisable for them to inform to their technicians to use a glucose containing bath or periodic infusion of 25% dextrose to avoid hypoglycemia. But eating during dialysis is absolutely not advisable. Another important part is it is absolutely not advisable to skip any dialysis during this pandemic, because you need to understand the resources in the hospitals are limited. If you land in an emergency, the consequences could be very, very serious and not favorable. Regarding drinking habit, it is again advisable not to drink too much of water, even it is in summer, because pulmonary edema due to drinking too much of water can lead to a serious problem. If you have any fever, cough, shortness of breath, or undue myalgia, not feeling well, please contact your nephrologist, because dialysis patients often get cough, often get cold, often get shortness of breath. We need to clinically identify whether these are because of your usual disease pattern, usual complications of dialysis, or secondary to the COVID, that need to be very clearly clinically judged by an experienced nephrologist, and after that you need to be tested accordingly. There are a lot of informations flooded in the social media regarding boosting your immunity. A lot of wrong informations are flooded in the society, in the social media. I'll caution all my dialysis patients, do not accept any of this information, because you need to understand dialysis patients are very sensitive for their diet. If by any food your potassium or electrolyte get imbalanced, it could have serious consequences. So stick to your diet which has been prescribed by your nephrologist or your dietitian, or before taking anything, do not forget to consult your nephrologist or dietitian to understand whether that particular item is safe for you or not. To boost your immunity, there are few things like vitamin C, vitamin D. These are safe and any renal failure patient can take it. But before taking, please consult your nephrologist. Yoga and pranayama tremendously help to improve our immune system, to keep all the internal organ healthy. So there is no harm to do yoga and pranayama. But you need to learn it from a proper source and the correct method. And do not overstrain while doing any yoga. It may cause serious pain or strain in your body, which is not acceptable. Last but not the least is the anxiety and tension. Do not be anxious and do not get over tensed, because anxiety and tensions are very bad for our internal hormonal milieu. It increases our cortisol secretion, it increases our stress hormone secretions, it increases our blood pressure, it increases our sympathetic overdrive, and all has a negative impact on your immune system. So how to get rid of anxiety and tension? There are a lot of techniques, there are a lot of meditations. In my YouTube channel, I have given some of the simple practices, practicing which you can get rid of your anxiety, you can keep your mind calm. Please follow that. And do not forget to subscribe to our channel. Thank you for watching. I hope the information what I have shared will be helpful for you. Thank you. Goodbye for now.